Okay, Jake is 6 weeks post-op. We gave him some heat prior to therapy for his left patellar fracture that he just recovered from. He just got out of his cast. And so we did some therapy, and now that he's finished, he's starting to get some swelling and inflammation. So we're going to use cryotherapy to try and control that and decrease his swelling and manage his pain a little bit. So because he's 6 weeks post-op and out of his cast, his wound has healed for the most part, and so he is in the very end stages of proliferation, fibroblastic repair, and entering the maturation phase. So that's why he's here at therapy, so we can make sure that as he heals that he's healing the right way. And so we're gonna apply his cryotherapy, in which the indications for that would be his swelling and his swelling and his joint and the pain that he's experiencing after therapy. Some other indications could be like muscle spasms or chronic pain, even acute pain or tendonitis or bursitis. Some contraindications: if someone has a cold intolerance, we would not use this on them. If they have Raynaud's disease, we would not use it on them. If they have a regenerating peripheral nerve or a peripheral vascular disease, we would not want to use this on them because they would not be able to, they would be too sensitive to the heat or to the cold. Some precautions that we'd want to make sure we were aware of: if somebody was very old or very young, we would want to be cautious about using cold. We'd want to be cautious about using over an open wound. Since he is 6 weeks post-op, his wound is mostly healed, but we'll make sure and check that before we do therapy, put the cold on him. Or if there is it's being placed on a superficial peripheral nerve, we would want to try and avoid that so we don't damage the nerve. So we're gonna get on with our treatment here. Hey Jake, how's it going? So you notice some swelling, redness on your left knee from therapy, and so we just want to control that. We don't want it to get too inflamed, so that we can so that it doesn't hurt, so that you don't limit your range of motion too much, because you're already starting pretty limited. So what we're going to do is we're going to apply cold. The purpose is it constricts your blood vessels so that it doesn't get as much blood and other fluid into the area, and try to keep the size of swelling down. So you're going to apply cold on your left knee. Is that okay with you?
Yeah.
Okay. So I just want to inspect your skin. You're taking a cold scab, and nothing that you want to worry about. Your wound is actually healed quite well, which is awesome. Want to maybe check for sensation. So, do you feel this? Feel this? How about this?
Yeah.
This? Okay. Good. So you got good sensation. I'm not too worried about that. So we're gonna apply this for you. All right, so just let me know if you have any pain with this. I don't want it to hurt.
They were like all over.
Okay, is this sensitive if I give it a little bit of compression? Is that painful at all?
No.
Okay, good. So if it's okay with you, I'm gonna get a strap, and I'm just gonna put it around this cold, so that it gives a bit of compression. We get better contact between the cold and your knee. Is that okay?
Yeah.
Is this the class that you said that
Everything looks good. So, now
Sideways.
we're going to start on our
Can you lift up your knee a little bit from there?
Alright. I couldn't find it. So I don't know. Find that out. Whatever you got.
Is that pressure okay?
Yeah.
Feels great. Lift up your knee one more time for me. Cold fingers, relax. Okay, how's that pressure? Do you feel like it's right over your kneecap?
Yeah. Feels
Okay.
right where I got my pain right now.
Okay, awesome. So I'm going to leave you on here for about 15 minutes. I'm going to set my timer right over here. I'm going to set my timer for 15 minutes. I'm going to give you this bell so that if you get uncomfortable or you feel like it's getting too cold, or you feel like it's just like too much pressure or anything like that, you ring this bell and let me know.
Okay.
Just so you know, it shouldn't be feeling painful. Like if you're feeling pain, then there's probably something wrong. So ring the bell, let me know. And your swelling in the pain should actually start to numb a little bit as it gets colder.
Okay.
But we don't want it any more than 15 minutes. If it goes more than 15 minutes or uncomfortable and you ring the bell and I don't come back, you feel welcome to take it off. Like it's not gonna hurt it. Just make sure that you take it off. We wanna take your safety seriously and make sure that you don't get hurt. Okay, sound good?
Mhm.
All right, I'll be back in 15.
Okay.
All right, Jake, how's it going?
It's going good.
How's your knee feel?
Feels a lot better.
Yeah?
Yeah.
Pain gone down?
Mm-hmm.
Okay, awesome. Let's get this bell out of the way. Does that compression help with the cold?
Yeah. Yeah. I felt like it made it a lot better.
Okay, awesome. This out. Okay, let's check that. Good. It's a little red, but it doesn't look like it's hurting the skin at all. Do you feel any of this? Pretty numb.
Mm-hmm.
Okay,
A
awesome.
little bit.
Okay, fantastic. Looks like the swelling is going down too. Okay, awesome.